Hey everyone, Ryan Turnbull here again, and we're back for part two. Now, we left off on washing your hands, but I thought we should go back to the wearing of the mask, and I thought one good thing to say about that as well and add on with that, you see that I do have facial hair right now, and when you're in a dental office, uh, I do I think it's the most professional thing to do is I will be shaving this, no longer will have the beard and will be clean cut. And that also works well with masks. It's good to be clean cut, clean shaved, especially as a male, because we're usually the ones with the facial hair. So that's something that I wanted to add on, and that's something that I will be implementing myself when the time comes. So let's get back to the washing of the hands. And like I was saying before, I grew up somewhat OCD. I've been a big advocate of washing your hands just well before COVID-19 hit this year. And some of the things that we can do, we'll go into more detail too later. But some of the things that we can do and what OSHA and the CDC recommend is that you wash your hands for at least 20 seconds under running water with soap and then dry off. So those are some of those things that we can, especially when we see a patient, after every patient, before and after, we're going to want to wash our hands. And I would say that's true with the patient as well. So I think as we get into our field and we start to see and get more experience, I'm sure I could imagine that one thing that patients like to do, especially after a procedure, is probably touch their teeth. So that's one thing that they're going to want to remember, and we'll want to advocate to them that, before each procedure, wash your hands, try to avoid touching your face. I see that a lot where a lot of people just, that's kind of a natural habit. They'll touch their eyes, touch their mouth, especially little kids. I have a daughter. They just don't realize that this is a big aspect of it, and that a lot of things can be transmitted pretty easily. So we've gotta stay mindful of that and do our part in that category. And it's not a bad thing to remind our patients about that as well. Also, another big thing that I think gets kind of glossed over, or there's not as high importance, is something that we might need to start implementing more of, and that is the no touch receptacles. So I think a big thing would be like the bathrooms. So instead of having handles on the faucets, you have more of the sensors, the running water, where you put your hands under and then you don't have to touch anything and the water will just disperse out. I also think that maybe it's time we start getting rid of the paper towels, especially the ones that you have to dispense yourself, where you have to do the up and down thing so that you actually have to put your hands on it. So how about maybe we can start getting rid of that, and we'll use the air dryers instead. That way we just put our hands under the air dryer. And another good thing with that is that we won't have trash, and we could possibly have less cross contamination. We won't be having to handle that trash. We won't have to transport that trash, and that kind of will knock that out. And I mean, hey, that's good for recycling. That's better for the earth. So we'll be doing our parts in many ways by the no touch receptacles. I also think another thing that we could do is, instead of having handles on both sides of a door, again, we'll take the bathroom for example. So maybe just have it on the outside, because you'll have to touch it anyway. And what I mean by that is that you'll touch it, go inside, and you'll have to wash your hands at the end of it anyway. So that way, when you're leaving, instead of having to touch a handle, you'll just have to nudge it open. Or one thing that I like to do is just use my foot to kind of kick it open. And that way, again, we're not touching, we're not cross-contaminating, we're not adding more to the transmission of it. All right, let's move on to the next one. So we have standard and universal precautions. So universal precaution, concept that treating blood and body fluids are to be treated as if known to be infected with a blood-borne disease. That's an OSHA standard. I think that that's a great mindset to have. It kind of keeps you aware, keeps you engaged. You don't get complacent. A big part of this is a mindset. Just knowing that when you know that anything could be infected, or maybe Anything might have, let's say, hepatitis C or hepatitis B, or even something, a patient may possibly could have HIV. You just never know, and you want to just always take that precaution, be professional, always have that standard in place, follow the guidelines. Now let's move on to standard precaution, which is the CDC standard, and that applies to blood, body fluids, including saliva, non-intact skin, mucous membranes. More information on standard precautions. Again, we mentioned this before, but just to reiterate, washing hands before and after every patient. Wear gloves when handling waste and pathogens. Use care when handling sharps. We'll also go more into that. And one that probably is rarely happens, but one thing that we used to back in the day, especially in our older our parents may have done is the mouth-to-mouth resuscitation. And if that would occur, we no longer want to do that. We want to use a mouthpiece or some other device that doesn't apply that contact. So again, we'll cover a little bit about the prevention methods. So PPE stands for personal protective equipment. We have the gloves, so patient gloves, which should be provided by the dentist or by the employer at no cost to the dental team. And then you have the utility gloves, and those are usually thicker gloves, more protective. And there's different times that we use those. Again, we have the hand washing. Again, follow those OSHA guidelines, CDC guidelines. Make sure to at least 20 seconds. A lot of people, I think, skip out on the 20 seconds. Don't do 5. Come on, no, we can't do 10. No, we gotta stay at least 20. Again, the masks. So we got the N95 respirators. We got the face shields. We've got the cloth masks. We got rubber dams and patient mouth rinses. Again, we got another one. Same slide pretty much, but just remember that this stuff is important, and this is a big part of it. We have our waste disposal. So the dentist is responsible for proper packaging, labeling, transportation, and ultimate disposal of waste generated in the dental office. Some importance about containers: you want to be rigid, leak resistant, pervious to moisture, strong, which means that prevent damage, prevent liquid leakage. You also want to have correct color coding on there. Is it biohazard? Indicate what it is. Again, we got to be following those guidelines, setting those standards. So some things that are of importance as well as dental office waste. So we have non-regulated, which is general waste. We'll go a little bit more into that in the next slide. Regulated, which is contaminant waste, infectious waste. We also have hazard waste and toxic waste. So some of the differences is non-regulated, general waste, stuff like in the bathroom, napkins, towels, wiping off. We also have recyclables, which are non-regulated, aluminum, glass, newspapers. Then we have regulated waste, extracted teeth. Here are some examples: infectious, scrap amalgam, hazardous, radiographic fixer, hazardous, sharps, infectious. And some importance to know about sharps is placed in closable, leak-proof, puncture-resistant container. And we'll go more into sharps in the next slide. Label with biohazard symbol and color-coded. A little side note is there's state and local regulations for handling these materials, and that all should be in our exposure plan and known. And there are websites out there that go more into depth because it's a lot of stuff. So, we'll be providing those websites and all that. So sharps container. So let's go a little bit more in depth in this. Location, easily accessible to employees. Closest possible to immediate area. Container. Now that may not be always feasible, but just do your best to have it at a good location. So the container can be made from a variety of products, i.e. cardboard or plastic. Again, emphasize on closable container, puncture resistant, leak proof, and color coded. Other information about disposing of waste: permits, containment, requirements, transportation and regulations, and this is the website that I was talking about, is ncap.org. And again, that's specific to rules and regulations under the state of Florida. I also found some of this information, especially the location and container. That information can be found at hercenter.org, and that's provided at the bottom of the page. All right, so we've got some housekeeping and laundering practices. So you don't want to be taking the protective clothing. It may not be taken home and washed by yourself or the dental team. You don't want to be bringing those bloodborne pathogens, those other bad things home where our family stays. You know, our children. We don't want to cross contaminate, and you know, those are just good practices to have, and they're not. Those are not what we want to do, is bring that stuff home. We can also have laundry, which it doesn't have to be outsourced, but it seems to be a common practice that it is. And what you want to do is place it in a leak-proof bag. Again, biohazard label, color-coded label, just like below. That's the biohazard symbol. Now we're going to move on to training requirements. Who should be employed? So all employees with occupational exposures. So that mostly includes everybody, if not everybody, in the dentist's office. They all need some type of training, and yeah. So then next, let's move on to initial and annual training. So you're going to want to have, for a new employee, you're going to want to have that initial training, and then you're also going to want to have annual training. So I would suggest maybe semi-annual, or either. I would be honest and say that you should probably do 3 months, 6 months, and 12 months training. That way you're always prepared. You know what's going on. You know what to do, because you never know when this stuff's going to happen, and it's not a good thing to be caught off guard. And it's especially when stuff as serious as this. We want to be prepared. We want to have training like this where you're talking about it, where you're telling people to be cognitive of it, and to be aware and have safety for everybody in the office. The client and the employer are responsible for the training, so they're the ones that need to take the responsibility and let everyone know about the training, and designate someone as that trainer in the office. Trainer needs no certs, however, should be an expert on occupational hazards of bloodborne pathogens. And the source that I used for this was the earthcenter.org, and that's provided at the bottom. That's where I got all this information from, most of it. So let's get into record keeping. Responsibility is again on the dentist employer. Records kept during employment plus 30 years. So even after they stop working there, you want to keep records on hand for 30 years. Some of the things that need to be included: name, social securities, proof of hepatitis B vaccination, or you can also refuse it, but you'll need to have that on hand as well. Circumstances of any exposure incident. So you want to, if you have some type of incident, you want to log it down. You want to have some type of proof or some type of evidence that this had happened, and you want to have a copy of post-exposure, a follow-up. So we got the chain of infection. So this is how it spreads. This is kind of how it goes through the cycle and how it affects us. So it's pretty key. We have the infectious agent, the pathogen, includes bacterium, virus, fungus, parasite. Then we have virulence, which is the strength of the organism and its ability to cause disease. Next we have the reservoir, place where the microorganism lives and reproduces. This happens in animals, humans, food, water, contaminated surfaces. I got this information from the book, the MDA, chapter 19. So we got the portal of exit, mode of transmission, what we'll be talking about in the next slide. We have the portal of entry, means of entering the body, which include the mouth and the nose. And we have the host, the person unable to resist infection. I think some things that could help with the host is, not only is it important to, obviously wear our PPE, but I think some things that could go a long way with this is to eat healthy, drink plenty of water, feed your body the good stuff.